Hi, everybody. I'll still give them another minute or so. Sompiwe, shall I keep my video off for the introduction because it might disrupt the screen share? I'm not sure.
You can keep it off. I mean, it doesn't really matter, but just maybe for introductory purposes, then maybe just keep it off.
Right, let's get started.
Yeah. Yeah.
So it's my pleasure to share Somefun.
Yeah. Seems.
I am experiencing enormous amount of
Seems.
Is that the same for you? Okay, so I'll go ahead anyway. So Shay Somefun is our postdoctoral fellow in the Women's Health Research Unit, and she's talking to us from Nigeria today. So we might have some difficulties with the connection, but we tried it out and hopefully it will do well. So Shay, as I said, started off and is currently in Nigeria, and that was where she obtained her bachelor's degree and also an MBA. And after that, she moved down to South Africa and she studied at Wits University, where she got her PhD in the field of demography and population studies in 2019. And she joined us in the Women's Health Research Unit in April 2020. And with the lockdown, we have actually not been able to be face-to-face at all during this period, but we've had lots and lots of connections with her, and she's going to be talking to us today about her doctoral research. So Shay, over to you. It's reverted to away from the slideshow view. If you could possibly get us back to slideshow view, I'm going to hand over to you right now. Shay, you're muted.
Can you hear me?
Yes, and we can see your slides in full slide.
Okay, perfect. Sure. Right. So as Deborah has rightly said, I'll be presenting my PhD work, which I completed in 2019, where I looked at sexual resilience among young people, and this was done. This is linked to achieving the Sustainable Development Goals 3 and 5. Just because young people are also important to the achievement of the Sustainable Development Goals. So my main research question was centered around the fact that I wanted to understand why young people who grow up in the same environment, in the same risk environment, have different outcomes. And this was because the literature around young people is focused on risks. Young people are seen as agents of risks, and there are not a lot of studies that acknowledge the fact that young people are engaging in protective sexual behaviors. So this is just a short story on two young people, Mary and Martha, who grew up in the same dysfunctional neighborhood, experienced similar risk factors such as parental divorce, also started exhibiting aggressive behaviors, didn't have role models in their community, and also had low grades. But we see that Mary exhibited a vulnerable trajectory because she eventually had an unintended pregnancy and dropped out of school. And this is Mary is the young person we're used to in the literature. but Martha exhibited a resilient trajectory regardless of her background and socioeconomic circumstances. She was able to finish school and add good knowledge of safe sexual practices. So basically, this is what my PhD is kind of focused on. I was trying to understand how Martha was able to, how and why she was able to exhibit a resilient trajectory. So what do we know about young people? We know a lot about risky sexual behaviors among young people. We also know what determines risky sexual behaviors among young people. In the literature, we know that age, gender, family support, social capital at the community level are factors that are associated with risky sexual behaviors among young people. And because of this, there have been so many interventions, even in Nigeria, to try to reduce the risks young people are exposed to, and also teach them about safe sexual practices. And then that is where the problem is. That's where I got the research problem from. Just acknowledging the risks associated with young people it doesn't solve the whole problem. It only gives us a partial understanding of youth sexual behavior. And for us for existing interventions to be sustained, it's important to acknowledge of what's working. And then protective factors in the lives of young people have been rarely studied. And also there's in literature, there's scarce knowledge on how these protective factors work at the individual level, that's within these young people, and at the family level, and also at the community level. Okay, so what did I do? So before going to the field, I thought, well, since there was a scarcity in the literature, it would be nice to also contribute to the literature to increase the body of knowledge. So I decided to look at the regional differences in positive sexual behavior among young people. So, this was the second year in my PhD when my proposal had gotten approved. As at this time, I was still framing it as positive sexual behavior, but after going to the field, I had to correct this language, and now I've started looking at it as protective sexual behavior, because when we say positive, young people, we're trying to move away from the language which sees sex as a negative behavior. We're trying to encourage young people to just have safe sex instead of seeing sex as something negative. So with this study that was published in Journal of Biosocial Science, it was shown that condom use among young people was high in sub-Saharan Africa. It was about 60% in most of these countries, but there was still a gender differential. So most of these countries, condom use was higher among males. And then the second paper, which was published in PLOS ONE, was focused on looking at the effect of family structure and adolescent sexual behavior among young people. And there was an unexpected result. This study showed that higher education was not a protective factor for sexual debut among adolescents. So what does this imply for policy? This implies that we should move away from education, formal type of education, and start looking at sexual education for the lives of young adults. So these are my research questions. These were my research questions. So I wanted to know. So for me to understand the why and how, I wanted to know who are the young people engaging in protective sexual behaviors in Nigeria, and knowing the who is just also kind of like a geographical frame. So where do they reside, and what are their social demographic characteristics? And the main question is why? Why do they choose to engage in these behaviors in the same environment as their counterparts who do not? I also wanted to know the social-cultural factors that influence youth young people to exhibit resilience in situations that would compromise their sexual behaviors. And also, I wanted to understand how they navigated challenges of everyday life in the face of extreme sexual vulnerability. And my last research question was focused on writing the policy brief to see how policy can best identify these mechanisms through which these factors can be strengthened among young people in schools, families, and in their communities. So my study used two theoretical frameworks. I used the ecological systems theory, and I used the risks and resilience framework. And where the ecological systems theory moves away from the individual and acknowledges that factors that affect a person are not just at the individual level; they are also at the family level, at the school level, at the community level. And then the risks and resilience theory is basically acknowledging that for youth to be resilient, they are both risk and protective factors. But instead of focusing on risk factors alone, this framework focuses on strength rather than deficit. And also the framework helps to understand why some young people exposed to high risks do not develop negative outcomes. So this framework focuses on the positive factors in the life of the individual, and also it helps us understand how these factors operate in the life of the individual. So in this theory, there are three frameworks that I used to for my study: the compensatory model, and then this model states that the factors that compensate for the presence of risk. So for instance, a young person who is living in a high crime neighborhood who might be exposed to the use of drugs, or comes from a family with good parental support, supportive parents. So the parental support might compensate for the presence of risks in that neighborhood, and which would now influence the young person's outcome. So it implies that protective factors can neutralize or counteract the effect of risk factors. And then the protective factor model suggests that protective factors would reduce the effect and exposure to risk, so they would lessen the impact in the young person's life. So how do these two theories how do they work for this study? So for a young person to be resilient, the person needs to have some individual assets. This could be such as coping skills and self-efficacy and competence. So this could be the protective factors in the life of the individual, and then they are termed as assets. Then linking this to the ecological theory, there are other resources, resources are external. The person it's not an individual asset. They're external resources in the environment, so like parental support, and then which is linked to the ecological theory, and then also relationship with peers. And this fits very well with the resilience theory, because literature influence of peers is always seen as a negative, as a risk factor. But then peers can also be protective factors in the lives of young adults, and also presence of role models in the community, and also their social networks. So my study was basically hypothesizing that there has to be an interplay of specific protective factors at different levels in the lives of the young adults that would eventually influence sexual behavior of this young adult. And also, in order to be resilient to sexual behaviors, youths must possess these internal and external assets. And the more assets present in the young person's life, the more they are likely to engage in protective sexual behaviors. And then some operational definitions in my study, I decided to focus on young adults aged 15 to 24 based on the UN and the WHO definition. And also for my study, protective sexual behaviors were defined as abstinence, which could be primary or secondary, condom use at last sex, single sexual. Okay, so what did I do to answer my research question? So first of all, I just couldn't go into Nigeria. I needed to have an idea of which of the states, or which young people would I be talking to. That's my first research question. Who are the young people engaging in protective sexual behavior? So I had to analyze demographic and health survey data to examine the prevalence of protective sexual behavior among young people. So this helped inform the selection of 4 study sites, where I also collected data, quantitative data, and qualitative data from these young adults. So this is just a visual representation of the study sites. And these study sites are, I would say they're largely representative of the major ethnic groups. Kano represents the north, Osun State represents the southwest, and I also went to Enugu State, which is the east, and I used Edo State as like a control state. So these states were the states which are the highest prevalence of protective behaviors according to the DHS. It just shows how I calculated my sample size. I used a sample size for single proportions, and I arrived at 571. So the aim was to speak to at least 571 young adults in each of the states. But I was able to speak to more than these people in the states, and my total sample size was about 2,339 in the 4 states. So how did I reach these young people? The countries, each state is divided into senatorial districts and then local government areas, and then I stratified by urban and rural areas. And I also, after stratification, I selected 3 local government areas randomly. And also, how did I reach these young people? These young people were, I wouldn't take the credit for just finding them. I had to use other young people in the state. So if I was referred to some young people in some states by friends, after meeting them and telling them the purpose of my study, they would direct me to some other young people. And then also I went to places where young people would usually congregate, like markets. Sometimes some places in Nigeria we have young people who are learning some trades, like mechanics or fashion designers. I would go there, speak with them, tell them about the study, and ask them if they wanted to participate. I also went to schools because I wanted to speak to both young people in schools and out of schools. So I went to schools, polytechnics, and churches. So I would, on Sundays, I would go to churches to speak to young people after church, and also informal places where young people would hang out, like play football or do other sports. So what some of the challenges I encountered during this study? This was the first time I was doing a qualitative study, so getting an ethical approval took about a year. So as at then, it was a challenge, but now I've learned the tricks in applying for ethics, and the ethical board were worried about the framing of some of the questions, and they were worried about asking young people aged 15 to 17 about their sexual behaviors. This helped me reframe some of the questions, and also it also helped me reframe the assent letters for the parents. So when I met some young people, I would ask, who were 15 to 17, I would ask them to take me to their parents so I could get assent. And the ones who I met in schools, I would speak to the principal, and then the principal would talk to the parents. I'm also assessing young people in some of the states was also difficult. For instance, in Kano, which is kind of a Muslim state, was a bit difficult. It was not as easy as the other states. And then also the use of open data kits was kind of difficult. So at the time when I collected my data, most people were used to the paper, collecting data via paper. So I remember when I would go to some places, people say, "Oh, could you just give us the printed version? I would fill it." And I was trying, I wanted to reduce the risks of data entry. And I was like, no, I had to explain to them, well, this is better. You just need to give me about 20 to 25 minutes of your time and all of that. So, but interestingly, I was able to overcome all of these challenges. So why does this data count? I believe like this data counts because it's spoken to a large group of young adults from the DHS, over 6,000 males and 14,000 females, and also about 2,000 males and females in the selected states, and also 16 focus group discussions in each of the states, and then about 10 in-depth interviews in each of the states. So this is the first results I'll be showing, and this is DHS data, which is showing the trends in trends of young people delaying sex, and this result shows evident gender differential. There's an increase for both males and females, but you can see that for males, about 57% were using condoms, were delaying sex rather, 2003, and it increased to 66% compared to 32 for females and 36. So what this also raises a question: who are the young females aged 15 to 24 having sex without condoms with? So also raises another question of this transactional sex going on among young adults in Nigeria. Okay, so I also presented some this frequency distribution of young people from the data I collected. So I collected this other quantitative data because there were some variables I wanted to control from the literature which were not in the DHS. So the DHS had some limitations like religiosity. So the DHS collects data on religion, but I wanted to go beyond religion to explore how important religion was in the life of the young adult. And also like presence of role models, social capital, which I haven't put in this slide, and also availability of recreational resources. So these variables are not in the DHS, and then I had included these variables in my data. And then from this slide, we can see that in all of the states, I tried to speak to the same number of females and males, but in Edo State, I got to speak with more females. Also, for importance of religion in Kano, which is a predominantly Muslim, most of the young adults said religion was very important to them. Also for role models, young people in Enugu, there were more young people who had role models in Enugu. I also asked a question on reasons for when they had their first sex and were they willing to have sex at that time. And about half of the young adults I spoke with said they were willing to have sex, and some of them said their partner persuaded them. I asked this question because I wanted to know how they were able to maneuver sexual encounters, and some of them said they did discuss the use of condoms in their relationship. So condom use shows that about 20% of the young people were using condoms. This is the data I collected, which is different from the DHS data. So another question I asked during this survey, after collecting this quantitative data quantitatively, was, okay, how did you negotiate condom use in your relationship? Knowing that a lot of young guys would say, oh, it's sweeter without condoms from the literature. And some of them said they discussed it before the relationships. And so some other reasons came up from the qualitative interviews, which I'll present in a bit. So this is one of the key results from the in-depth interviews, and I've used pseudonym Mulu. So this is just trying to my results, linking my results with my hypothesis. This is a young lady who had, before the age of 5, had relocated from her village, so she had to move away, and also lost her siblings and lost her father. But from what we can see, she was still able to overcome the challenges she had faced in her early life to finish university. At the time when I met her, she had a good knowledge of HIV and also condom use, and had knowledge of safe sexual practices, and she was in 3rd year at the university. So we could see that she had assets, like she was a determined person, and then there were some factors at the community, the presence of school library, and fairly consistent electricity, and also at the family level, a supportive elder sister. Some other quotes that came from the qualitative interviews were at the individual for the young people were being able to negotiate condom use, wanting to use condoms, and knowing the importance of using condoms, and also discussing with their partners about the use of. And parents were also very key, and this is in the literature, the importance of parent-adolescent communication. Young adults who spoke to their parents about sex had stronger reasons to want to use condoms. Some of the young adults also said they spoke to their friends and who told them, oh, you wouldn't want to drop out of school, so if you're having sex, you should make sure you're using condoms when you're having sex, or maybe you should practice abstinence, or just have one boyfriend and do not engage in transnational sex. And transnational sex was common among the young people in polytechnics and the universities. So being able to access pharmacies where people would buy condoms was also very, very useful to the young adults. So some young people were able to access this, and some of them were not. And so this is just still, it's kind of in line with what we find in literature, where community healthcare workers or pharmacists are still stigmatize young people for wanting to purchase condoms that would help their sexual health. So what are the strengths and weaknesses of this study? I think the major strength is the mixed method approach. But then the outcome, some of the outcome variables might have been influenced by social desirability bias. While the use of ODK would have helped the participants feel at ease, I found out that sometimes when I was asking people if they have ever had sex, there would be a pause, and this can be linked to the gender norms and cultural norms in Nigeria, which would affect young people being expressive about whether they decided having sex or not. So what do these results mean? I think it's I believe it's very important that we keep on acknowledging the fact that young adults are engaging in protective behaviors that are good for their sexual health. And then some of the young adults are still able to show resilience even in the face of risks. I spoke to some a particular person I interviewed had experienced rape, and you would expect that would affect her sexual life negatively. But then she was determined to use condom in her current relationship. And also it's important that parents keep on talking to their young adults. It's very important for their sexual behavior. And what do these results imply for policy? It's cost effective. So if we're trying to see how we can ensure youth development in a cost effective way, it's important that we look at interventions that have worked and try to understand why they've worked, and in places where they are working, to instead of coming up with new interventions, it's important that on existing ones and then sustain them, and it's better that we build upon the strengths of youth, so that because it all promotes their feelings of competence and efficacy, and it will also foster investment in ensuring that these protective changes endure within their communities. Also, for my study, I'm finding that we should try to change the language we use to describe sexual behavior. Describing sex as unsafe and risky perpetuates stigma. And one of the key results I found, like young adults, why they wanted to use condoms, they were really scared. They had a fear. It was a fear approach towards sex. So it would be nice that we change the kind of messages. We should stop using fear-based tactics. Young people should can have safe sexual. They can have a protected sexual health, and depending on how we fine-tune these messages. And also, I also found that young adults were beginning to engage in other forms of sexual practices outside penetrative sex, just because we're trying to avoid pregnancies, like kissing and anal sex. But then if we're giving them the right message and not using fear-based tactics, this can also help young people stay protective even when they're engaging in other forms of sexual interactions. So parents can definitely do more. It's important that we include parents in these interventions. Also, NGOs and religious leaders. Religion was very important in the lives of young people and for their sexual behaviors. So interventions must look beyond the individual approach and focus and look at how they can use people in the communities like NGOs and religious leaders, and also local government leaders, to change the way they view young people. Thank you.
Thank you so much, Shay. Well done. Coming all the challenges. People who would like to ask questions can just put up their hand. Then we'll, when you're ready, then unmute and Shay can answer anything that you have to ask her. Jane, I see your hands up. Can you go ahead?
Thank you so much, Sarah. I really enjoyed your presentation, and I take note particularly of the reframing, both the way you went back from working in the field to reframe how you were looking at it, and then your recommendations. I wanted to know a little bit more about the parent-child communication. So were you able to explore what it is in that parent-child communication? Is it the content? Is it the process? Is it the availability of a parental-like figure rather than a parent? Because that is an issue for many adolescents. So just a little bit more detail on that. Thank you.
Okay, Deborah, do you want me to go one after the other so I could take this and then?
Yeah, please do.
Okay. Okay, so yes, this is the availability. So it's the availability, because a lot of young people would say they couldn't talk to their parents about how they were feeling, like when they started feeling some changes in their bodies. I would ask them, so who was the first person you spoke with? And most of them would say, oh, they spoke to their friends, they spoke to this person, they spoke to some cousin and all of that. But most of them didn't have their parents being available. But some of them did. And the ones who did, it was obvious that it helped them in making decisions. So it's the availability. We haven't gotten to content yet. So it's availability and the relationship. So they haven't built enough relationships with their young adults yet.
Thank you.
Any other hands? I see there've been thanks to you, Shay. This in the chat. There was thanks for the insightful presentation. I've got a question to you, and it's about next steps. So, if you were given free range and funding, how would you take this research forwards, either in South Africa or in Nigeria, according to where you found yourself? Have you had thoughts about that?
Yes. So the first thought for me would be to work with young people. So for the interventions we're thinking about, so the first intervention would be to work with religious leaders, and whatever work we're trying to do with religious leaders would be to work with young people to see if they find whatever we're doing acceptable, because I feel like all of the interventions we've been working on, we're working on it outside the people we're designing the interventions for. So it would be important to, if we're designing interventions for adolescents, young adults, it's important to get to hear what they want, because we assume we know what they want without including them in what we're doing. So it's important to speak with them and work with them in designing these interventions from pilot to implementation.
Great, thanks. Yeah, and the other thing that sort of struck me is that amazing achievement of 2,400 questionnaires, the survey that you conducted personally using the Open Data Kit. I was starting to understand it better in that you used respondents seem to have completed the questions by themselves, and you said they're on phones. Would that be on their own phones, or did you use a number of tablets? Were you able to reach a number all at once, like a group? And how long did it take you to gather that data? It's a remarkable achievement.
Okay, thanks, Deborah. So like I had acknowledged, this was doable because I used young people in the state and answering your question on phone. So the way it worked is, once I loaded the questionnaire on the data collector's phone, if I went to a place where there were so many young people and they had phones, of course, I also encountered a lot of young people had phones for this kind of data, which was what I didn't think about before the work. But when I went to a place where a lot of young people had those phones, I would send them the questions offline to their phones, and then they could all fill it at the same time. Or a lot of the data collectors would go to a place and speak to about 10 young people. That was the second approach, worked better, because sometimes they didn't understand some questions and they needed data collectors to explain to them. So like I would have like 10 people, we've identified a place to meet these young people. So that's 10 phones. 10 phones, if we're going to be there for about 30 minutes, that gets us for that particular day. Maybe we speak to 30 people on that day. And in each state, I did spend an average of 3 weeks to 1 month in each state. But then also the good thing was I was doing this concurrently at the same time as I was recruiting young adults for the qualitative aspect of the interview.
Wow, multitasking. That's remarkable. Please, and
Thank you.
Stephanie's got questions. Please go ahead. Steph, you're still muted.
Hi, good afternoon, everyone. Thank you for a splendid it is very heartwarming to see how hard you had to work to conclude to all these research questions. So yeah, thank you for your presentation. It was very insightful. I simply loved how you strategized to access the adolescents in the garages and the church, places, and then you went to schools and lesson centers and sports centers. Well done. My question today for you is, seeing that you spoke about the access letters to parents and how they responded on these lessons. I mean, it was a couple of years when I went to one of our schools and I had to do sexuality in the schools. And then on sending letters to the parents, it was crazy the way the parents reacted to those letters. You know, they still have this mentality that it is their responsibility to teach the kids, and that the teachers should, sort of just help them and not help to decide the kids for what it is worth, regarding your sexuality and all that. So yeah, having 60% as a role model, I mean, in one of your researches in Indigo, I don't know how much we can say here in South Africa, in our South African schools, how much of these kids have proper role models. But getting back to my question, the letters to the parents, did you read them? Did you have access? How did you get to your final, consensus to how you are going to approach, the parents to be more involved in um, our adolescent sexuality? Thank you.
Thanks, Steph. Well, so to be honest, I didn't interview any parents like formally. I didn't record any of the interviews, but I did speak to some of the parents of the young people aged 15 to 17. I did speak to them in the light of when I wanted to ask the question. Some of them were a bit reluctant, and I had to explain the study to them and tell them, because they felt, oh, I was exposing their young people to this, and I had to tell them, these young people know about this already, so it's better they get it from you. So I spoke to them like in informal ways, not as a researcher or asking them any questions or recording it. So it was by speaking with them, I got to know that they don't want to, it's like an elephant in the room talking about sex with a number of Nigerian parents. Seems like, oh, they don't want to do it because they assume young people do not know about sex. So I spoke to them and they're like, oh, they know about it already. So it's better they hear more from you because they trust you. And it's better they're getting information from you because they'll be getting the right information from you. But that's also something I considered for a further study. But I probably haven't just conceptualized how to think about. I haven't thought about it. So what would it be? Would it be to educate? To educate parents? But I did think about speaking to religious leaders because religious leaders is easier because when they are teaching these young people in the religious institutions, they can bring the subject up. It's probably easier to do that. I did speak to some of the community leaders. They helped me in assessing those communities, so I did speak to them. But for parents, no, I didn't speak to them like directly, but I did get a sense of how they felt on sexual matters being discussed with their young adults.
Thanks, Shay. Excellent.
Thanks, Shay. I just want to say, like, Shay, I've been on governing bodies in the primary schools and the secondary schools, and that is major issues. And where it stems from, it's the parents. It is their uneasy feelings or their reluctancy to sort of, give consent for the child or the adolescent to be, given, sexuality information around sexuality. I mean, so yeah, I think it's a huge problem. Our teachers were taken out of schools. There's no longer classes or any on those level to educate our kids in that regard. So it will be a huge thing to have a research running around those. But well done, Say. I think we're on the right track. Come on, girl, let's do this. Thank you.
Thanks, Steffi. Thanks, Shay. I think you really need to get together and have a conversation, even if it's virtually for the time being. Any other questions from the audience? Anybody got more for Shay to answer? Okay, Shay, so that just remains for me to thank you so much. Well done. Thank you for overcoming all these difficulties and challenges with being in Nigeria while we're asking and expecting various things that you should deliver here in Cape Town. And we really do look forward to seeing you soon. And I think this research has opened up a lot of interesting questions for further efforts. Thank you, Shay, and thank you everybody for coming to the session. Bye now.
Thanks, Say. Bye-bye, everyone.